Hello, I'm Dr. David Berceli, and I spent most of my professional career studying trauma in cultures. Now, when people first talk about trauma, the first thing you think of is, well, a natural disaster such as a hurricane or an earthquake, or maybe a car accident or the house burning down. And those are, in fact, traumas. They're considered hard traumas. You could actually pinpoint the date and time that this event affected your life. But what's more pervasive in most of our cultures and society is what's called soft traumas. Soft traumas are traumatic experiences that we have over prolonged periods of times, but we're not even aware of them. If we grew up in a family environment where the mother and father argued a great deal and it felt unsafe to the children, or maybe there was substance abuse in the family, or even if there was great financial strain and the parents often argued as a result of this, the children may have grown up very much feeling very unsafe and fearful much of their time. This is considered a soft trauma because it can still have the same effects as a hard trauma. The effects would be something like the person lives with perpetual anxiety, they're constantly irritated or withdrawn, they have difficulty sleeping, they might have nightmares or disturbing memories. All of those symptoms are the effects of both soft and hard trauma. What I've recognized in society in general is that most of our cultures suffer pervasively from soft traumas. And the way you can see this is that you can see a rise in substance abuse within the culture, domestic violence, family violence. You could see people being arrested more frequently, a lot of social disorder and chaos occurring. All of those experiences at a societal level would suggest that there's a societal breakdown, or what we call mass trauma or societal trauma. Once I recognized how pervasive soft trauma was in our cultures, I realized that we needed new methods to deal with mass trauma, trauma that's on a large scale, such as an entire culture or family or organization or even a school system. I developed a series of exercises called trauma-releasing exercises. These exercises can be done with an individual or can be done with large groups. The exercises are unique in the fact that they specifically target the muscle groups in the body that are affected by traumatic events. You should check with your service provider to make sure these exercises are safe for you. Your service provider can lead you through the exercises, guide you through them safely, and instruct you how to use them without the aid of a professional therapist. And these exercises should help to bring you and your family members and friends to a great deal of inner peace and calmness.